What better way to start a Monday than with a little laser treatment? What do you think, Jennifer?
I love lasers.
I do too. So Jen caught me in the hall last week and she's like, Kerry, we need do a little refresh. And
because that's what friends are for.
That's what friends are for. And I agree wholeheartedly. I just don't like to bug her because she's so busy, but we said, okay, what can we do? And you threw out CO2, which is all-time favorite.
All time.
I love it too. I've had it done before, but it does have a little bit of downtime. So then you threw out XF.
The Palomar XF fractional laser.
And I said, love that one too, Jen, but that makes me a little swollen and red, and that's about a week for me of downtime. For most people, maybe like 3 days. 3 days. Okay. So then I kind of said no, and then I said, what else you got for me? She said,
I got a lot of lasers.
We've got a
lot of lasers. Yes.
So PICO was what you said, right?
That's right.
And we're gonna do a little PICO treatment. It's gonna help with fine lines and wrinkles and pigment. And you said
if we can just get like a little close up. So this is one thing. When I have patients come in, they're always asking me, what do we do about these little wrinkles right here? They want me to put Botox here, but we cannot a lot of the time because that muscle is holding a fat pad down. And if we do Botox there, the muscle allows that fat pad to fall forward. So if you can get a close up on Kerry, this is, you can kind of like smile for me a little bit. So you just see these little wrinkles right here. This is what we're going to be treating with the PICO today. I'm going to do her full face, but my goal is around here. We need to stimulate a little collagen.
That's how much I love you guys, letting me see my wrinkles. Just like that. Let's just get real close up. Can you get that zit too, Jen? Anyway, so we're going to do the treatment.
Let's do it.
Let's do it. So you guys, if you're just a little, summer goes by, we do a lot of just outdoor stuff, and it takes its toll. So if you could get in for just a little laser treatment, it's gonna make a big difference. Jennifer, how many treatments do you have to have of the PICO?
I think that with the PICO, because it's non-ablative, you need to do a series, 4 to 6, 1 month apart.
And you said you wanted to do a little experiment on me.
Yes, I'll be doing on Kerry, because we can with the PICO. I'm going to do it every 2 weeks to see if we can get our maximum effect a little bit faster.
Okay, let's do it.
First step, I just want to get her squeaky clean, although she already washed her face.
And I'm not doing numbing, but you usually put a numbing cream on, right?
That's right. I'll do numbing cream to make it more comfortable for you. But Kerry is such a superstar, we don't need to.
I mean, it might hurt a little, but I'm just going to grin and bear it for you guys.
We use titanium goggles to protect her eyes. Go ahead and lift up, and then lift down. Are they pinchy at all? Are you okay?
No, they're not pinchy.
Okay, go ahead and turn your face to the right. So I'm going to be doing this section first.
And then we talked about this, but about how long until you see results?
It is going to take 30 days for us to see any collagen stimulation. But she will notice her skin softer and smoother around day 3. She'll get a little peely. She can scrub it off. So her skin is going to feel better. It's going to look better in 30 days. And you have to do a series of these to stack the collagen on top. Here we go. 1, 2, 3.
And it doesn't hurt. It's warm. I'd say it's pretty loud next to my ear. I don't even know if you guys can even hear this. Jen, I've got some trouble spots with a little irritation and maybe slight rosacea. Is this a problem for rosacea?
It might make it a little pink because we have a little heat on it, but I don't think it's going to be a big problem now.
Are there any people who can't get PicoSure?
What a great question. PicoSure is safe in all skin types, even skin type 4 and 5.
So people who have darker skin who maybe can't do IPL can do PICO?
Absolutely. Absolutely. It will help with pigmentation. It's approved to treat melasma. We're targeting fine lines and wrinkles today for Kerry. Sometimes if a patient has little pink veins, I'll get one of our other lasers, the XLV, and I'll treat those red veins first, and then I'll do the PICO right on top. How are you feeling?
I feel fine. It's not
a little
pain.
warm?
It's a little warm. It's not painful. When the light gets close to my eye, it's a little distracting. It's hard for me to focus on the questions.
How's that feel?
It feels like a wet kiss.
So is that a good thing?
Wet, cold kiss.
Okay, I'm not kissing you, just so you know.
Are you sure? Okay.
Okay, here we go. Really snappy on you. When I have patients that have facial hair or a lot of pigment, it's much louder and snappy.
What are you trying to say? I have a lot of facial hair. I mean, good Lord. You go up close on my wrinkles and then you talk about my hairy face.
It is really snappy, though.
Yeah, it's super snappy.
Which, I mean, I don't have a lot of pigment and I don't really have that much hair, do I?
I don't think so.
Is that going to change the result at all if it's snappier?
It probably has all the dead skin washed off of it, so that's why it's snappy. Turn a little bit more towards me. Perfect, right there. I'm going to be going right here. I don't want to surprise you, okay? Count of 3. 1, 2, 3. So I'm going to get really close to her eye here in just a second. What I like to do is pull down. Make sure her eye is covered, but pull down so I can get as close as I can. Here we go. 1, 2, 3. For those little wrinkles that we want to stimulate. Collagen. Help resurface the skin a little bit. We need to tighten the skin here in this area.
Now, I've noticed, Jen, that, with the Santa Ana winds that we've had lately, my under eyes have been much puffier than normal.
Yeah.
Do you think that I'll be more aggravated because of allergies and the wind?
You could be, yeah. I mean, you can take an antihistamine. I think your skin is going to be a lot more drier as well, and that's going to make your wrinkles appear, more so. So using Dr. McNeil's Smooth Eyes and Bright Eyes, my two favorite, will help with minimize the appearance of the wrinkles because they'll be so hydrated. I firmly believe in great products, medical grade products, long-term, can have long-term effects on your skin.
But as always, the most important thing is to protect your skin from the sun.
Of course it is, absolutely.
Which I do religiously, and I still get sun.
Yeah.
You do a good job. I try really hard. But you guys, I wear sunscreen on the way to work at 7:30 in the morning or 7:45.
I'm going to close up and show her. We're done with that sheet.
So I'm probably a little red,
It's a little red, yeah.
and it will get a little worse over the course of the next 30 minutes, I'm going to guess. But then it'll subside in about an hour.
We'll do this side. Do you want the ice on this left cheek or the right cheek?
I'm totally good.
Good, okay.
We'll just go for it.
Here we go. 1, 2, 3.
Hi, Nana.
Nana's watching. Nana is my mom. She's at home. She's one of the biggest Kickin with Kerry supporters. So shout out to you, Nana.
Hi, Nana.
Oh, Nana. So for those of you that are just joining us, like Nana, we're just doing a fall little refresh. We're doing PicoSure laser. This is a non-ablative. I called it a laser, but is it actually a laser?
Yes, it is.
It is a laser. Okay. Non-ablative treatment, fractional. It will help with pigment and fine lines, and it's not uncomfortable. As you guys can see, I do not have numbing cream on. It's warm to the touch, and I mean, it's distracting because it's loud. As Jen was saying, it's a lot poppier with me. I think it's just because it likes me. but she said it's because I'm hairy. So we're just going to town on this, and Jen gave me a couple choices of laser treatments. This one is the one I chose because it's the kind of least downtime. I'll just be a little red. It will subside for me in about an hour, and she's recommending, for most patients, she recommends, you said 4 to 6 treatments, Jen?
4 to 6 treatments, 1 month apart.
But for me, she says she's going to do it for me every 2 weeks because she can, and she's doing a little experiment. We'll tell you how that goes. I'm excited to be the guinea pig. I get to be the guinea pig here for lots of fun things. And we talked that you can do this treatment on all skin types. It's safe for all skin types. The laser that John's using is a PicoSure laser. We're using it for, the refresh that we talked about. But this laser is also used for tattoo removal.
Well, we switched the head. So the machine, the motor, is the same, but we switched the head, so it's completely different energy.
Yeah, and so...
And wavelength.
We can do tattoo removal, all types of tattoos, colored and, just black. It treats, greens and yellows and reds, which is difficult to treat. And it takes fewer treatments than the older Q-switch technology. And I'm a little more quiet because around the eyes, I wouldn't say it's more uncomfortable, it's just a little bit more jarring. Yeah.
Okay, head straight. I'll do your chin next. So you see she's getting pink on both cheeks. But it's not bad. It's not going to bleed or ooze or swell. It's just going to be pink. Sometimes I'll move her lips too.
And what does that do?
Kind of plump them up a little bit.
Okay.
I do that when I do microneedling or when I do PICO.
Are any lasers done with numbing is a question.
I think most all lasers we usually numb. But Kerry was a superstar and she didn't numb today.
It's optional.
I would recommend numbing, but I'm a sensitive Susie. I like lots of numbing.
What about the neck area? Do you do that too?
Absolutely. I have some good pictures I'm going to post with before and after the PICO. We can do it with our face and with the neck. People will come in on their lunch hour and get this done and go back to work.
I'm going to say that on my chin, it actually feels kind of good.
So basically what we're doing is we're using heat and energy to make an injury in the skin. By making the injury, that will cause stimulation of new cells, new collagen to come to the area for skin resurfacing. Most patients will get like a little peel around day 3, and I encourage them to exfoliate that little peel that they get, and then their skin is really smooth.
Is there any other aftercare for this laser?
Just gentle wash and gentle moisturizer. It's going to feel like a sunburn for the next day or so, but that's it. Not bad at all. These little fine wrinkles up here on the upper lip, Kerry does not have them, but I treat a lot of patients that do. I love to laser them, and I love to put filler in them.
What filler do you use for those types of wrinkles?
I love Rustle and Refine. For those, it's so silky and soft and smooth, and it moves. Okay, I'm going to do your lips, so keep 1 second. 1, 2, 3. Little lip. This will plump the lip a little bit. Stimulate some collagen. Great. Nose next. Not bad, right?
No. So you were saying, because I know you're on my nose right now, I've got some broken capillaries around there. So people, I'm sure it's frustrating to patients because they're like, why can't that laser do everything? But there's different lasers for different things, right? So
That's right.
the broken capillaries you would treat with the XLV.
That's right.
And then you would do PicoSure over it on the same day.
Absolutely. It's oftentimes I'll do 2 or 3 lasers on a person in the same day.
That's pretty cool.
Yeah. I mean, you see me running down the hall with my patient. I'm like, oh, we're going to bop into this one real fast. And
We have another question. What's the smoke?
that is...
fire, ladies and gentlemen.
No, it's just the burning of the hair. The peach fuzz of the face.
Nothing to be worried about.
Yeah, no. And not everybody has that. I'm surprised you can see the smoke. That's impressive.
Yeah, I know. I can't even see it.
Your skin's looking smooth from our Botox treatment. Or Dysport, whatever we did.
Yeah, I think we did this part this time. Yeah, what was that? 3 days ago?
Yeah, something like that.
Wonderful.
Well, that's why I love Dysport, because you see it so fast.
Yeah. So you guys, on Friday, it was part of that same conversation that Jen was having, saying I needed a little refresh. And I take no offense to it. She's a good friend. She's taking care of me. And so we did a little toxin, and she chose Dysport. In our office, we have Vitamin, Dysport, and Botox. And why did you choose Dysport for me?
I like Dysport for little tiny wrinkles. Lots of little tiny wrinkles. That's what I have. I use Dysport on myself. I think it spreads really well to get all those little tiny wrinkles. And I like it the faster onset of action. I don't like to have to wait for anything. I'm pretty impulsive. But don't get me wrong. I use all of the toxins.
Yeah, different ones are
For different things.
Yeah. You said little wrinkles. I kind of like that. That sort of seems
They were
like a
very
compliment
little wrinkles.
after calling me hairy and other things.
That's what friends are for. Yeah, see, as close I get to her hairline, you see more smoke. It's just little fuzzies. That hair will grow back.
And you guys, again, this is not uncomfortable. It probably looks a little like crazy because there's the flashing lights and the noise, but it is not uncomfortable at all. I am doing fine without numbing. Simple, really.
Right. It's the easiest one. Like I said, even though I do my CO2 and I do my other lasers, I'll bop in here and I'll do a PICO just if I had a little time, just because I love the no downtime and I'm doing a little something for my skin. You don't want to wait until you look in the mirror and go, oh man, what happened? You want to start preventing now. It's harder to try to reverse, you know?
Yeah, so is this for a 30-year-old? Is this for a 20-year-old?
Absolutely, absolutely. You know, I love microneedling, but I do think it's for the younger population. You know, as we age, we need a little bit more sometimes, and I think that you gotta graduate from that microneedling and get into a laser. Okay, I've done about 8,000 pulses. That's what I do. I watch to see how much energy and heat I've used, and we've used the maximum amount. Look at how beautifully pink Care Bear is. Let's take these off. You see a line down for us. She just looks like, you know, little cute and pink. Put a little sunscreen on ya.
And what's the most effective laser for scars is another question.
CO2.
CO2, and then you should post a photo tomorrow so we can see if you're still red. We'll definitely post maybe a story or something.
So this is sunscreen. It just cools you down immediately. There's no special aftercare, just gentle wash and moisturizer tonight. She's gonna feel like a sunburn. So when she washes her face, just use lukewarm water.
Oh, I feel like I'm at the spa. Thanks, Jen.
I know, a little massage. And you want the ice roll at all?
Nope, I'm good.
And there you go, she's ready.
Thank you so much, and thanks for watching, you guys. We'll try and post that picture. I got a little something.
There you go.
Okay, bye.
Bye.
Bye.